Diseases of the heart are the #1 cause of death and disability in the United States and most European countries. Vitamin D deficiency, common in the United States, is associated with increased high blood pressure. This is because vitamin D decreases the expression of the gene encoding renin, which helps control blood pressure. In randomized controlled trials, vitamin D supplementation reduced systolic blood pressure in senior women by 9% in 8 weeks. Aging is a risk factor for vitamin D deficiency. As we grow older, we have reduced capacity to synthesize vitamin D in the skin when exposed to sunlight. And we're more likely to stay indoors or use sunscreen, which can reduce the production of vitamin D by 95%. According to information provided by the Institute of Medicine, low levels of magnesium result in resistance to some of the effects of vitamin D. There are several causes of magnesium deficiency in seniors. Seniors have low dietary intake of magnesium. Intestinal magnesium absorption tends to decrease with age, and urinary magnesium excretion tends to increase with age. In addition to aiding in the function of vitamin D, magnesium supplementation can result in a 35% reduction in certain types of blood clots that can lead to heart attacks. Adequate magnesium intake is also known to reduce obstructions in blood flow, referred to in medical literature as atherosclerosis. Atherosclerosis has been shown to predict heart attacks and strokes. The atherosclerosis risk in communities study found increasing serum magnesium levels to be associated with a decreased risk of heart disease. Other double-blind, placebo-controlled studies of supplemental magnesium have reported significant blood pressure lowering effects. A review of 42 randomized controlled trials comparing calcium supplements to placebo on blood pressure reported a reduction in both diastolic and systolic blood pressure with adequate calcium supplements. Low dietary vitamin K intake is associated with an increased risk of a hardening of the arteries, as demonstrated by chest X-rays. Studies of seniors indicate that their intake of vitamin K is usually insufficient to avoid the risk of calcification of portions of the circulatory system. Autopsy studies found copper levels in the heart muscle were lower in patients who died of heart disease than in those who died of other causes. Vitamin E supplements caused a dramatic 77% reduction in heart attacks in the Cambridge Heart Antioxidant Study, which was a randomized placebo-controlled trial in Great Britain. Ultrasonography and angiography revealed that high levels of vitamin E are associated with an improved flow of blood in blood vessels, and therefore less risk of heart disease. Vitamin E is uniquely suited to intercepting free radicals and preventing a chain reaction of destruction to vital components of our cells. A study of approximately 90,000 nurses indicated that the incidence of heart disease was 30 to 40% lower among nurses with the highest intake of vitamin E from supplements, but not from food. Now, most people probably aren't familiar with homocysteine, an acid in our blood that often increases with age. It's important to know that studies have demonstrated that high levels of homocysteine can be an important factor in heart disease. The results of more than 80 studies indicate that even moderately elevated levels of homocysteine in the blood increase the risk of cardiovascular diseases, including heart disease, stroke, and peripheral vascular disease. The amount of homocysteine in the blood is regulated by folic acid, vitamin B12, riboflavin, and vitamin B6. All of these must be obtained from the diet or from supplements because the body does not synthesize them. Chromium is considered a contributing factor in the prevention of heart diseases. In 12 out of 15 controlled studies, chromium supplementation was found to have beneficial effects on the risk of heart disease. Foods high in simple sugars, such as sucrose and fructose, increasingly common in United States diets, are not only low in chromium, but have been found to promote chromium loss. Vitamin C supplementation of 359 milligrams per day produced a 25% lower risk of coronary heart disease in a pooled analysis of 9 studies of more than 290,000 adults over a period of 10 years. The risk of death from cardiovascular diseases was 42% lower in men and 25% lower in women who consumed 300 milligrams a day of vitamin C supplements, based on the federally sponsored First National Health and Nutrition Examination study. Treatment with vitamin C has consistently resulted in improved dilation of blood vessels in individuals with atherosclerosis, as well as those with angina pectoris, congestive heart failure, high cholesterol, and high blood pressure. Boron supplementation can increase serum levels of vitamin D. A study has demonstrated that a boron-supplemented diet can result in less calcium and magnesium excretion by the kidneys. Several major studies have found a significant increase in illness and death from cardiovascular disease in individuals with low serum selenium levels. Selenium is an antioxidant that reduces potentially damaging reactive oxygen species to harmless products like water and alcohols. REQ49 Plus is the only multivitamin and mineral formula that aligns with the findings of thousands of peer-reviewed scientific journal articles as an aid in the prevention of heart disease, as well as immune dysfunction, muscle weakness, heart disease, dementia, depression, metabolic syndrome, cancer, arthritis, osteoporosis, and vision disabilities. These ailments usually take years to develop and can easily be dismissed as the normal result of aging. REQ49 Plus provides the critical nutrients to help prevent these conditions, significantly improving your quality of life. REQ49 Plus, precise balance for a healthier life.